what you need to understand is that things are changing. I'm sure everybody is realizing that in your medical school curriculum. You might be hearing from your teachers that MCI has changed and they are teaching competency based curriculum. I'm sure you are hearing it from your teachers. Okay, because now things are going to be very different. Okay, earlier the focus in Indian schools was more of what we call as vertical teaching, subject by subject, year on year subjects come. But now the focus will be on horizontal integration of subjects. The content will be taught based on organ system wise. Earlier the focus was majority on written exams and how much you can memorize, and then around 20% focus on practicals. But now it is not just about knowing how, it's about showing how and doing it actually. Okay, so more and more focus is shifting from rote learning to what we call as patient centered learning. If you enter your anatomy class, you need to know whatever I am learning today, how it is going to impact the patient. Okay, and that is what you need to understand. Okay, things are changing drastically and on a rapid basis. Okay, not only in your med schools but globally. All right, and which is why it is all the more important that you are ready for the change. I'm sure all of you are aware and have heard from your faculties that MCI, erstwhile MCI, did release this competency mapping. I have been speaking with faculties and deans of different medical colleges, and they have started the implementation. COVID has been a very different situation, but otherwise, yes, this is what I mean. In a general physiology lecture, where earlier the teacher used to teach from certain slides, people used to just learn, mug up, and just answer. Things have changed. Okay, things have changed. They need to present what exactly competency they are trying to teach. They need to have lectures, small discussion, if required, bedside clinic, involve patient care in early years of MBBS. More importantly, earlier there was nothing called as vertical or horizontal integration. If a physiology teacher taught you anything, that's it. But now MCI expects that in a similar topic you will have a biochemistry teacher coming in and pitching in, and a community medicine, which is a second year subject, coming in and chipping in. So this is called as horizontal and vertical integration. Point is, how many of you or your medical colleges have implemented? We are not sure, but this is the reality, and this is how the next exam is going to be. So you need to gear up and focus and ensure that you are ready for this next examination. Okay, without getting a license, it's going to be very difficult. Okay, so clearing your license exam will be the first step. People have tried, but still we don't know. I mean, post COVID things have changed, but yes, we are seeing this change, and ultimately all the colleges across India are going to focus and ensure this new form of learning. Now, since the announcement of the next examination in the month of February 2020, okay, what we found at Moksh was that all and maximum first year students from the top medical schools in India, especially the first and second year students, came to us and started preparing for the USMLE Step 1 examination. Okay, and this is what actually, this is exactly what made us realize that yes, things are becoming more and more aligned with the global requirements. Okay, if you see the Step 1 of USMLE, The focus or the testing areas are your first 2 years of MBBS. The portion of step 1 is first 2 years of MBBS, and you appear in the third year. So what they're focusing on: medical knowledge, applied foundation knowledge, patient care, diagnosis, history taking, patient care management, health maintenance, disease creation, and practice based learning environment. This is what a USMLE exam tests you. Now, if you are going to compare it with the upcoming next examination, you will realize the similarities. Next exam also talks about 60% of problem solving, which is going to be applied clinical concept, 30% comprehension analysis, which is to do with patient care diagnosis, and only 10% recall. The reason Moksh never taught NEET PG, or we were never into training of NEET PG, because NEET PG was more focused on rote learning, and we are global educators. We train for global examinations, and our focus was more patient centered learning. But now with an advent of next, definitely our faculties are well equipped to train you for next, because we have been teaching USMLE for now decades. Okay, so this is something which you need to understand. I get questions from students: sir, next subjects are only clinical, then why are we correlating it with step 1? The reality is, the clinical portion, for example, anat or biochem or physio, there is absolutely correlation with your future subject. For example, if your 10% applied basic anat is not strong, how will you do well in your surgery? If your pharma, patho, physio is not strong, how will you do well in medicine? There is a stringent importance on public health or PSM. All right. So my point is that now with the announcement of the next examination, students have realized that preparation of USMLE from first year makes absolute sense. Okay. Now, for those asking the structure of exam or exam format, next is going to be a 3-day exam. Day 1, medicine, 120 questions, 3 hours, pre-lunch. Post-lunch, you'll have pediatrics, 60 questions, 1.5 hours. Day 2, surgery, 120 questions, 3 hours. ENT, 60 questions, 1.5 hours. Day 3, OBGY, 120 questions, 3 hours. Post-lunch, Ophthal, 60 questions, 1.5 hours. Okay, it's going to be 3-day examination with pre and post-lunch subjects. Now again, I get questions: sir, all of these are final year subjects, but please understand there is a 10% weightage to basic medical science and 10% to public health. So if your fundamentals of first and second year are not strong, these exams are going to be a nightmare. And please understand, your degree is dependent on this next examination. All right. So what will be a typical timeline? Earlier, what was happening in India, when you go North India, when you go to East India, West India, or South India, the internship cycle would be different. The exam cycle would be different. Okay, so there was a lot of confusion. Graduation dates would be very different. But now the proposed National Medical Commission has mentioned that ultimately everybody has to converge in such a way that your final exams of MBBS shall be conducted in January. Okay, this will happen for every student. And once your final exams are over, the next one exam shall be conducted in the month of March. If you pass the next one exam, only and only then your internship starts. So there is a precondition to this. April to March, 1 year compulsory internship. Okay. And once you complete your internship, your practical exam, next 2 triggers. Once you clear the next 2 exam, That is when you will finally get your MBBS degree. Okay, and a rank of your next one marks will determine your PG seat. Okay, so this is how has been the proposed timeline. All right, this is exactly the proposed timeline. Now the point is, okay, the point is, if you are at this point of time, okay, right now they haven't announced the confirmation, but at this point of time, if you do not clear the next one examination, you might lose a year. If you do not clear next two exam, you might lose a year. Right now they haven't specified the attempts, which is why it should be of a concern to you. Okay, and moreover, if you get a lower rank, again you will have to wait for a 6 month or a year period. So all I'm saying is, already MBBS is a long process, 5.5 years in India and 6 years in medical college abroad. On top of it, if you are not clearing these examinations, there might be additional drop year before you start your PG. So make sure you guys are preparing from next, or moreover, at least whatever you are studying in your med school, you are studying it more detailed conceptually. Okay, that is going to be very, very important, because your career, many people want to do PG abroad, many want to do PG in India. Irrespective, if you wish to come back to India even after 20 years, you will not be able to skip the next exam. Okay, we get a lot of queries, sir, I never want to come back, so can I do a course in Russia and then just move to America? Yes, you can, but the point is, it's not possible for you to spend your entire uh, career maybe abroad. At some point of time you might want to come back to India. At that time you will have to face the next exam, so might as well give it now. And those who are in med schools in India, please understand, without clearing the next exam, you are not even getting degree. So there is no question of you pursuing PG, whether in India or abroad. Okay, so with this, please understand that you have to start practicing for more and more MCQ based questions.